going on, everybody? I am here with a familiar face, Josh Halbert, uh, FRS instructor and trainer extraordinaire, co-founder of Learn Mobility, learnmobility.com, etc. How's it going, buddy?
Good. How are you doing?
I'm good. Can't complain. What's new? What's new in the world of online training?
Nothing much. It's funny. I was deciding whether or not I was going to wear my glasses if I wanted to look because we're talking about longevity today. If I want to look younger or more
Yeah,
professional, but now I see that you have glasses, so I didn't want to leave you out.
yeah, dude. I got punched in the face with the vision thing. I think I was telling you the other day, my vision's amazing, and then I got up one day and I looked at my phone for some reason, and then I looked at it, I was like, what the fuck is happening? And then I thought that I had oil in my eyes. You know, and you get like your eyes are watery or it looks blurry. And so I'm like
Yeah,
rubbing my eyes and rubbing my, I'm like, no, it looks pretty fucking dry. I'm like, oh no. I just got punched in the face with age and I couldn't cars my way out of that. There's nothing for near because nothing you can do, man. It's ridiculous.
it's weird how like your body like has to make a choice, and it's like, look, I need to keep Dre alive, but in order to do this, like he can't read the phone within 3 feet, and it just makes that choice.
Well, you know what? This is funny because it brings us into the topic of conversation because as soon as I said that there's nothing you can do for your age-related myopic problems, there's going to be someone on Instagram who is going to tell you that eating, I don't know, some particular food or avoiding another or doing red light therapy or something would fix that problem. But that kind of brings us into the topic of conversation today. We got together today to talk about um, I guess in general, this newfound love of biohacking that we're seeing online, and more specifically, I think I wanted to talk to you about the concept of longevity. So this biohacking longevity concept.
Hmm.
I don't know if you saw that on Netflix. They have a documentary of a guy who's trying to live forever. He's like
Oh, I saw that. Brian Johnson. Yeah, yeah.
what's his name? The guy that wrote Singularity, Kurzweil. Is that what it
He
is?
looks like a Kurzweil. Yeah, yeah.
Yeah, he's like that. He's like 50 million pills and all of this stuff. My kids, so they're like, they think this guy's batshit crazy. But this is a big thing now, this concept of longevity. But with regards to our specific field, I think we should probably zoom in on the concept of the longevity of the musculoskeletal system, right? I
Hmm.
don't know. We need to explore. There's a lot of nutritional things that we can discuss. I've seen everything online from kale is bad for you, drinking water is bad for you, eating, what else I say? Blending your fruits apparently changes them so that they're not good for you anymore. Technically, you can go online and convince yourself to stop eating in its entirety at this point. But I think more specifically for our specialty, I want to talk a little bit about the physical longevity, like what is going to push your physical longevity into the future. Does that make sense?
Yeah, I mean, I think it probably starts off with, uh, and we've talked about this many times, is the concept of entropy,
Hmm.
right? And if I had to do like a completely reductionist definition of entropy,
Hmm.
I would say it's where you have the same input, but you get diminishing returns on the result,
Okay, I'll take
right?
that.
Yeah, I mean, if you want to add to that or change it, but
Well, I mean, maybe to add to just for everyone knows what we're talking about entropy, which is the the normal decaying from organization to disorganization through time, or you can call it, Sir Arthur Eddington called it the arrow of time, and the idea that at time zero, when you have the creation of a living being, there's a certain amount of organization, and then in time, that system will deorganize or undergo entropy, um, all the way till the person dies kind of thing. So entropy is that normal gradual, we just kind of talked about it with my eyeballs, that normal gradual deterioration. And I guess longevity, if you want to be scientific about it, is even the idea of biohacking is the conscious effort to try to quell the speed of the entropy. Of course,
right, to slow down.
you can't stop
Yes,
the obviously the entropy, but you can quell it.
you can
Um,
speed it up for sure. which means you can slow it down,
Oh yeah, I
right?
mean, the vast majority of people are speeding it up, and that brings us to the point of this conversation with regards to physical longevity. I was just reading for example, in North America, worldwide, but specifically in North America, despite all of these amazing new technologies and you know, we know this about nutrition now, and we know this about supplementation now, and we know this, exercise is good for you, and all of these recommendations. The rates of osteoarthritis are rising dramatically, and I thought it was particularly interesting. In one study I was reading, is that the rates of osteoarthritis are rising dramatically, and when they tell you what the reasons are, right, for the rates of osteoarthritis. There's the normal ones. Of course, we have an aging population, right? And
Hmm.
that obviously is going to lead to us. We also have we're living longer, right? So of course that's also going to lead to but the one that I saw was the increases in physical activity leading to wear and tear, which I thought was amazing
Really?
just to read as a sentence, right? Because
Right.
I think this is where we want to get into. I've been talking about this a lot on the last couple of podcasts, but I think there's a general idea. Well, there's a general concept that exercise is good for you. And therefore, if you're doing exercise, that you're adding to your physical longevity, or that you're quelling or warding off preventable problems like degenerative osteoarthritis.
Hmm.
This general idea of what exercise is and the magic um, things it does, or what it does and what it doesn't do, is confusing to people. Like if you take a body and you get it to move around, yes, the movement itself, of course, is healthy for you in a systems kind of perspective. But there is a lot of physical movement and excessive physical movements where to the joints of the body, which is really what we're trying to preserve in terms of physical longevity, where exercising might be detrimental, if that makes sense.
Let's double click on that because I think there is a concept of wear and tear.
Mhm.
And so are you trying to say that beyond the need to keep the quality you have, you can exceed the stress that you're putting on that tissue can exceed the tissue's ability to recover? Or is
Yes.
it, yes.
No, yes, but that's
Okay.
not what I was referring to. That's a good point. Now, what I was referring to is the fact that when you go out and exercise with the stuff that you have the way it is, right?
Hmm.
Get up in the morning. We talked about this before, and you can do your morning mobility flow routines and move around and do all of this kind of whatever. But the fact is that when you do things like that, or general exercise patterns, you're moving within the boundary conditions of what your anatomy will allow. You know what I mean? So,
Sure.
for example, I always use this shoulder, probably because it's easier to use this because you can't see my hips, but you have that shoulder that has no independent rotation or motion. Everywhere you move, there is compensation patterns because your shoulder itself can't move. So I think what I'm trying to refer to is what people are getting confused, or not confused, in that movement in general has systematic effects, right? On your circulatory system, on your cardiovascular system in general, on your mood, your well-being. So these are generalized effects of it. But if we're speaking
Hmm.
specifically about the longevity of your joints, of Josh's shoulder that's not moving, no amount of exercise will bring health or longevity to an articulation that is already undergone stress and wear and tear, and that is degenerating such that it's not even contributing to your overall movements anymore, right? Moving my shoulder around like this, I can move my shoulder around like this, every day for the rest of my life. But what it's not going to do is make any specific changes in the space between the glenoid and the humeral head, right? If that glenoid and humeral head doesn't move, or moves, you know, as a single unit, then the mechanical health benefits of movement are not going to be realized in that shoulder. But you're still getting the benefit of exercise, right?
Right.
And I
Right.
think that this is, I know some people that listen, they think that this is too specific, but again, we have to think in terms of I'm a manual practitioner as well as a trainer, and you're a trainer, and we are tasked to specifically improve, help, maintain physical longevity. So that concept is one of those things where we need to know when we're programming for our clients. But the general advice on Instagram is exercise is good. That's what I was referring to.
Yeah, I mean, there's a lot to unpack there because with somebody with that kind of that jacked up shoulder,
Mm.
you still want to have like they in a better world, it's better that they move
Yes.
ideally than they don't move,
Yes.
right? And if somebody is not doing
Okay.
yeah,
I'll put a pin in that, but let's in general,
okay,
we'll say yes. Yep.
yeah, just for all the systematic benefits
Mhm.
that we had mentioned, right?
Sure. Yep.
Um, but if you're not doing something specific to actually address whatever that their abnormality in their shoulder is, if it's just a lack of rotation or or something going on with the capsule, then you're going to get the global benefits of movement, but you're
Mhm.
not really addressing entropy and the decay of those tissues specifically in that joint.
Brilliant. You're going to get the global benefit of moving, but you're going to get the specific detrimental effects of immobility in the joints that are not contributing to that movement, right?
Right,
And
right.
that's a good point because with regards to literature, if there's one thing in this topic that literature is very clear on, it's that immobility or immobilizing an articulation is immediately detrimental almost to that articulation. To the extent that as a therapist, when you're taking someone post-surgical, one of the major things you need to do is input movement into that person as soon as humanly possible. Because anytime AC joint separation, dislocate, whatever, you're put up into this position, right, where you're bound. As soon as that joint stops moving, the quality of the connective tissue starts to decay. The robustness of the healing tissue um, is 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 um, is less, right? That you're going to build less tissue, pretty much because, as we know, the mechanics of movement and the afferents and the system that comes from that movement is what then guides the system to decide what to do with that joint. Do we more nutrient
Hmm.
waste product needs to come out? Like, you know what I mean? So, um, yeah.
I think I think it looks like we're all catching up to that too, because I have a client who's going to get another knee replacement surgery on his organic knee that he had left. And like 15 years ago, he got his first one on his other knee. And he
Mhm.
was saying, he'd been meeting with a doctor, and he was saying, well, he's like, nowadays is like they try to get you to get up and start walking like the first day as soon as they can. And he made it sound like as if they didn't do that as well. They didn't prioritize that. So, I mean, to your point, it's like, you need to get that thing moving as soon as you can, which is good. It looks like maybe the tide is kind of turning in rehab where they don't want to they want to immobilize for as little as possible. If they can get away with not doing it or doing it, with 3 weeks instead of 4 weeks, they'll do that because of
Mhm.
the reasons you said is that, I mean, if you're not moving, you're basically sitting into your body to get rid of the stuff.
Yeah. Well, yeah.
Yeah.
Or I guess, yeah, you're sending the signal, but even more specifically is if we understand that the main goal of the living system is pretty much to reserve energy. Um, your body is really poor, or if it does anything, at taking an articulation that's not moving and saying, you know what, we got to fix that. We got to do something. It'll just as easily wall it off and say, if you're not using it, then we'll just take away degrees of freedom from you, and we'll scar that
Mhm.
tissue down, and we'll make it so, because if you're not going to use it, why would we spend energy to maintain it? And that's the thing that I think is another really important thing to remember, is that the job of your body is really to conserve energy. Like that's what the system is trying to do. So if you want to change what's going on, you have to consciously put forth effort into reversing that process.
So, kind of speaking to what we
Well,
talked about
again,
earlier
for
about,
example,
yeah,
if
go
you
ahead.
if you want, well, no, actually, go ahead. I'll come back to it, but go ahead.
No, when we talk about wear and tear,
Hmm.
right? And you look at like professional athletes, you look at somebody you've worked with, right? And they go to they've got, let's say they've got hip pain, or whatever, and they've had it for a long time, and it comes back, and the doctor's like, "You're bone to bone now,
Mm.
right? You've gone bone to bone. You wore that joint out."
Mhm.
In your perspective, what has happened there? Is that from an entropy standpoint? Is that just from abuse? Is that a genetic thing? Like,
Mm.
how do you kind of think about that when you hear those types of stories?
Of course, there's genetic. You're talking about, like, let's say an athlete. Is that what we're
Right.
talking about?
Let's say a gymnast or something that's been doing, that's almost at the Olympic level, and then he's like 33 and now he
Yeah.
needs a hip replacement or something like that.
Well, here's the thing. Yes, there's genetic factors. You can't downplay the genetic. There's a multitude of factors, but and I've said this before, the fact that we can predict exactly where the degenerative changes are going to occur based on the sport, right?
Mm,
Tells us that the forces being absorbed in that sport are abnormal for the human condition, right? The fact that I can tell you that if you make it to the NHL, and I've assessed, I don't know, hundreds of NHL hips, and they pretty much almost come out looking very much the same. There's only
mm,
a few athletes that I've assessed and dealt with as a hockey player that had something resembling good hips, but for the most part, the abnormality of taking the human system that has evolved such that when you put a sagittal force into the body, it moves you forward. I should have turned this off. Sorry about that. Um, when you now put a blade at the end of that foot and you change the mechanics such that in order to propel yourself forward, you have to put a coronal or a lateral force into the ice. It's that over time is an abnormal stressor to what the system had evolved to do, right? Sports are an abnormal or artificial boundary condition that we place on the system in order to allow the system to output a particular result. But that result, as we often say, is not for the athlete, it's for the sport itself. So in other words, hockey might be good. This gets back to what we were saying before. Playing hockey, recreational hockey, is good for you because exercise is good for you. But playing hockey is not good for your hip, right? It's not for your hip. Your hip is
mm,
used to play hockey with. But if you take a human hip and you make it a hockey hip, and then you fast forward 20 years, you can very easily predict the end result of that which is osteoarthritis of the hip, a complete lack of internal rotation, adductor changes in the tissue, the architecture of the tissue of the adductors, reason why there's so many adductor problems in hockey, right? So I think
mhm,
back to your point, it's like it all goes back to the idea, which is also in social media land, this conceptual framework that performance training is somehow the same thing as longevity training, and it's not. And that's
mm,
that's what that's the point I was trying to make. If I want to maintain my joints, keep them healthy over time, playing hockey repetitively is something that you have to consider in your exercise to counteract the effects of hockey, right? So you can, of course, get all the systematic benefits of playing sport and going out and exercising. But if you're going to be a hockey player without specific exercises for your hip, for example, to thwart the problems that come with the biomechanics of hockey, you have to specifically do that. And that's where I think, again, this general idea of exercise performance being good for you, that has to be unpacked, right? That has to be really considered, especially from our perspective, right? If
mhm.
you're giving an epidemiological study saying, yeah, go out and exercise, it's going to keep the population healthier. Yeah, of course. But if I
Yeah.
just, if I look at your ankle and I go, wow, you have no ability to tilt in your subtalar joints and your dorsiflexion is restricted. And when I ask you to run, your pelvis shoots out laterally, and you have a high amount of lateral sway on your foot impact, telling that person to run might not be the most specific um, advice that you could give with regards to longevity of the musculoskeletal system.
It's like saying like a car with like flat tires, if you just drive it, the tires will take care of themselves. It's
That's
like, no.
that's exactly, and yeah, you'll go and the car will move, and you'll agree that a car that's sitting on blocks for 10 years is probably not going to function well. Like it's not good for it, but you have to, but yeah, like you're saying, that you can drive on bad tires
Yeah.
for an amount of time until you can't. And that's the knee replacement and the hip replacement.
So in the hockey example, right? Again, we're talking about like degenerated joint. You're saying it's going to be more of a combination of the vector and the directional force that's unnatural to how the hip loads and deloads, plus the volume of that unnatural loading. I hate to use the word unnatural because it gets bastardized, but it really is like it's just you're not
I
meant to
don't
trap,
know if unnatural is the right word. I think repetitive is the right word. Any
but
movement, any
uh-huh.
repetitive movement, you could argue it would eventually become unnatural or bad for you, right? Because
Right.
yeah, I mean, you're when you
But
move,
not
but
not natural, but like not congruent with the mechanics of sagittal motion of the hip,
for
essentially.
example, yeah, but I mean,
Right.
if yeah,
Yeah. Like you can go ice skate here and there and you'll be fine, right?
yes,
You could just go enjoy it as a recreational activity, but it's eventually there's a point where now you're making action, you're loading that so much that you're causing adaptations
hmm
to the joint, at the bone level or deep tissue level where it's maladaptation to what you want.
because we know that there's an upper limit of adaptability of human tissue, right? You can only squeeze so much juice out of that lemon, right? So if you're doing the same
Mm,
thing repetitively, then you're stressing the same tissues repetitively, which causes two problems. Number one, you start to abut against the ability for cells to adapt to your inputs, right? Because you're doing the same thing over and over, and you're with the same movement over the same line of tissue over and over and over, and you usually outdo your ability to recover from the previous thing you did because there's such repetition, right? Chronic stress injury. The other problem with that is because you're doing the same thing over and over and you're using the same lines of tissue, the other lines of tissue will eventually stop receiving adequate information and those will eventually become walled off. And it's like we say, if someone comes in and they say, I'm going to go into a squat contest in 3 months, and I'm going to exclusively train squats and accessory exercises that will help me squat. And you do what we do, a functional range assessment at the beginning of that decision, and then we do one at the end after that competition. I can 100% tell you that the findings of the FRA pre and post are going to be dramatically different because
hmm
you're going to create a squatting hip. And a squatting hip doesn't require the degrees of freedom of a regular hip joint. If anything, when you're squatting, you're going to be hearing a coach tell you to confine the variables of the motion such that you're producing this very specific biomechanical output. And if you do that, and the more you're confined, and the better you get at squatting, right? And the more you hone in on the exact same tissue lines, the faster you're going to butt up against their inability to adapt at the speed you need them to. And then you're also going to see the detrimental effects of immobility, like we talked about before, but from a
hmm
cellular level. Like I think one thing to note is that immobility, they always think about immobility from a joint level. And you spoke to this. You said that it's getting better. Like when you do a hip surgery, they get you up and they get you moving right away. Phenomenal. But the idea of immobility, if thought about from a microscopic level,
mm.
not the same, right? Like if you're doing bicep curls and you tend to do a bicep curl, only maybe with your arms locked into one of those
The preacher curl or the other one,
awesome,
yeah.
awesome exercise. Don't get me wrong. But if you're always in that preacher curl and you're always grabbing the same bar and you're always moving in the exact same way, there are other areas of the bicep which are not going to be adequately stimulated, right? And this goes back to the concept that a muscle is not one thing, it's thousands of things. So you can be using your muscle in one vector, and you would only be using a very small portion of that muscle repeatedly. So now you do the, oh, I love preacher curl. I did it again. I did it again. I've done it again. I've done it for 10 years, 20 years. You run up against this problem where the rest of your bicep is almost forgotten because it's not receiving mechanical stimulation because you keep doing the same thing over and over.
100%. And I think that that plays into longevity. And, you know, what got me thinking also when you were talking about the lines of tension is that, you know, you see people respond to this and they give the idea of like cross training,
Yes.
right?
Yes.
Which is like, okay, if you're doing hockey, then we need to make sure, you know, we're going to do, I don't know, crawling on the ground or shin box drills because that's going to get your hip in different positions, right? Which superficially sounds correct,
It is.
sure,
Yeah,
right?
superficially correct.
Yeah, but you don't take into account like the signal that you're sending. Like, are you loading those actual lines of tension? If you're
Mhm.
just visiting them with very low intensity and not a lot of duration, you're not really signaling to change. You're just kind of checking a box. So I think
Mhm.
we inherently kind of can put together, you're like heuristically, like, yeah, okay, like I'm only moving in one line. I need to do other things. But then where they kind of miss the target is that they don't actually train the other directions. They just go visit them in the warm up,
Mhm.
right? You know, we're going to do a lot
Oh,
of sagittal plane workout, but don't worry, for 5 minutes, we're going to do some multi-directional work. So that should cover our bases.
yes, that's right, because they're really concentrating on the one lift, but the rest of it is kind of prep for that, right?
Yeah.
Like
Yeah.
it's that's a very good point. I would also argue that, and what you're saying is 100% correct, and you should do that. It's like the idea of cycling through prevent accommodation, you want to cycle through a variety of different exercises, for example. You can't just do the
Hmm.
same exercise over and over because your body gets used to it. So you might select other exercises. But again, it's a scale problem, is that people, you can select 5 different exercises for your biceps, different mouth noises for the bicep, for example, preacher curl, concentration curl, dumbbell curl, barbell curl, whatever. And you might very well change some of the angles of stress on the tissue. But like I said, a bicep is really made of thousands of individual muscles that are surrounded by a thicker layer of fascia. And the idea that selecting 2 or 3 different lines is going to, activate the muscle in its entirety. Like if you take the cross section of a muscle here, how would I draw this? You take a cross section of a muscle, and that muscle, of course, is divided into bundles, and then those bundles are, they're house individual muscle fibers, right? And let's say this is a cross section of a bicep. Now, I can't draw the number of muscle fibers because I don't have enough time and I don't have enough red. Actually, I have another one here. I don't know if you guys can see this, but I'm
Yeah.
drawing all of these muscle fibers. And the fact is that when you do your preacher curl, as we know, the Aller-Numb principle of contraction means that when you contract, it's not that the entire muscle contracts. The Aller-Numb principle refers to motor units. So when you do a bicep curl, you might activate these motor units. You might activate these ones here and some of them here, and then you choose a different exercise, and that kind of gets the ones over here. So now so now we've covered that, we've covered this, and we've covered this with our main exercise and 2 accessory exercises to stop the accommodation. But what happened to this guy, right? What
Mm.
happened to that guy? You would almost have to choose, you would have to choose an exercise in every direction, actually, to really stimulate all of that, which is why, I mean, we keep talking about what not to do, but a solution to this would be to understand the concept of shape change with regards to exercise. So I was thinking about this and I run it by you now. There's a shape to an exercise, and people are so locked into the shape that they're in when they're doing the exercise. Whereas if they were just taught to change the shape dynamically through a set, we call a continuous tension set, where the shape of the exercise changes as you're,
Hmm.
that would ensure that you are actually um, causing adaptation in the entirety of what we consider the bicep muscle, right?
Yeah, it's like in martial arts, like like traditional like katas,
Mhm.
the variant of the kata, that's the shape,
Yeah.
right? Versus actually, real world things where there's no set shapes and you're shape shifting all
Yeah.
the time. So
Yeah.
yeah, I mean, if you can, if those are listening, if you're like, all right, well, how would I apply this? If basically you can make your sets more three-dimensional, like if you're
Yes.
doing push-ups, like leaning to the side, pausing, changing the angles in real time, and loading that, not just like, well, I'm going to turn my hands out the other way and I'll just kind of do a couple easy sets. Like, no, if you load differently while you change the shape of the exercise,
Mhm.
um, you can start to try to hit multiple cross sections of the tissue.
I had a buddy of mine, funny enough, he's another parent of at wrestling when I bring my kids wrestling. So I was talking to him and he was telling me how he started doing I forget how many push-ups every single day. Like he's like I just decided I'm going to do whatever 50 push-ups a day. So he'd been doing it for a month, and then he was telling me about this soreness in his shoulder that he started to develop like 2 weeks in, and then he goes 2 weeks further and it's getting worse, and now all of a sudden I'm going to continuously do push-ups for the rest of my life because I did it for 4 weeks and I had to stop because my shoulder's fucked up. And
Yeah,
I asked him, I go, well, show me what you're doing. So he gets into a push-up position. He's like, well, why are you doing it like that? Well, that's because online, that's how you do a push-up. You're literally told this is how you do and then insert whatever mouth noise you want for an exercise. And people have this predetermined concept that there is a correct way to do it and an incorrect way to do it, and that you have to adhere to the correct way no matter what. And that's what he was doing.
hmm,
And in the exact same position. So I was like, and when you break it down, even for a layperson, I was like, well, why don't you just change your hand position? Right? Why don't you just, instead of always doing the sets like that, why not, fatigue yourself here and then spread your arms out and see what you can find there. And then when you fatigue there, bring your arms in and see what you can do there. Oh, but that's a tricep push-up now. Who gives a shit what it is? A tricep push-up is also for if you're just training your chest, this is different than this, is different than this, is different than this. They're all going to train a different aspect of your chest. It's funny that I brought that up because it's the fact that the mouth noise always refers back to a muscle is another one of the problems, right?
yeah,
Bicep curl. Instead of saying, let's train the tissue on the anterior aspect of my arm, we call it a bicep curl, which immediately brings us back to physiology first grade when you're like, well, the bicep does this. And we know
yes.
not only the bicep does a lot of things. So it's almost like in the simplification of naming exercises, we're almost funneling people towards their doom.
Well, yeah. Well, that parent you were talking about, he was only feeling the purple on the board,
Yeah,
right? Because he kept doing the same way. So he was getting sore in the places that were only getting loaded. He wasn't dispersing that load.
absolutely.
Which, to bring it back is also part of something you have to take into consideration with longevity
Hmm.
is, if we think of like the big rocks for longevity, it's like, I mean, you want to preserve muscle mass for as long as you can. In fact,
Hmm.
if you're at an age, you basically should try to continue to muscle build for
Hmm.
as long as you can. So doing inputs, eating the way that you would want to eat to promote muscle building, because it's pretty clear that muscle is like the number one anti-aging capacity that we can have as far as like your ability to deal with glucose, your ability to live independently, absorb force from falls, and generally just be, harder to kill.
Hmm.
So you want to promote muscle mass. And you also want to keep, if not promote, more range of motion that you have, or keep the range of motion that you have that are relevant to you.
Hmm.
Um, and part of that is also both of those is training differently,
Hmm.
right? I mean, you could do, your routine, like example, Like my dad, he's been working out, probably since he was 12, and he's like in his mid to late 70s,
Mm.
and he still does the same exercises, right? And it's great that he's doing them, but like, I mean, his both of his shoulders are bone to bone at this point. He has like no external rotation, and like he's benching, he's doing his things. And I'm glad he's doing it, but if you can almost see people like that where it's like a Coke can, and like as you start to crush the Coke can, their range of motion get smaller and smaller throughout their decades, and
Mm.
then their exercises selection goes down.
Mhm.
It's like, well, I used to be able to do it here. Now I can only do it here.
Mhm.
I was here in my 50s, but now I'm here in my 60s and I'm here in my 70s. And
Mhm.
of course, that affects everything else when it comes to reaching behind in the car to get what's behind the back seat, right? Or to do other things. So, in addition to keep promoting muscle mass, you want to make sure that you're keeping the range of motion that you have,
Mhm.
training them.
Mhm.
So I think that's kind of a missed conversation in longevity is mobility.
Well, yeah, because like what you're saying, if your dad was adamant about doing that exercise, but then you say, out of curiosity, which exercise were you doing where your arm was in that position? If the answer is none,
Mhm.
then I'm going to venture a guess that if you ask your dad to go into this position, that he'd probably do something like this.
Yeah, he couldn't get his hand behind his back, right?
Yeah,
Totally.
your body does what it continues to do, and it walls off what it doesn't, right? And that's I think is the point is, and then yeah, your dad's, it's great that he's doing that, and he's going to maintain muscle mass that way and all of the things that you said, but that one point, it's such a simple, it's not simple, it's simple conceptually, but that one idea that out of everything we know about longevity, let's break into the biohacking concept. Ice baths. We can have a conversation right now about ice baths, and we could probably conclude at the end, if we're literature based, the most that we can conclude is that probably good, right? It's probably good for you as a functional system. Now, get a little more specific in your questioning. Is it good for the longevity of my articulations? If it actually does reduce inflammation, right, then I would argue that less inflammation is better for joints than more inflammation, right? So that's kind of that, but that's what we know. Like, does it make you feel good? Yes. What does the literature say? The literature is pretty on ice baths, right? No matter how many people tell you that it's the greatest thing in the world, it might be good, but it's not 100% that it's worth your time, right? I would argue,
Mm,
for example, sauna has more backing literature to make it more worth your time. Again, I'm not saying do an ice bath. I want everyone to understand. But then we start to go down the rabbit hole and then we start to get into red light therapy. Is that good for you in terms of maybe like the literature? Yeah, possibly. But you know what is 100% irrefutable is that specific articular motions are going to maintain those specific articulations because movement is really the only thing that maintains the health and longevity of human articulations over time. To the extent that if you are, it doesn't matter if you're injecting that shoulder with glucosamine and you're injecting it with collagen and you're ice bathing it and you're saunaing it and you're red light therapying it and you're eating, well, and you're taking all these things, those things might help, but for damn sure, if you take your client and you specifically input more joint specific motions throughout their day, every day, till the end, I can guarantee that you are not wasting your moments in time. Where I
mm,
cannot guarantee that when we talk about something like an ice bath, specifically for the longevity of your shoulder or your articulations.
right.
You know what I'm saying? Again, I don't want to,
Yeah.
so many people are going to jump on here. "Oh, I've read it. It's not great. It's fine. It's probably good. I would not shy away from it. I have a sauna. I'm in the sauna but for sure I'm moving every one of my joints to the extent that they can move. and I'm consistently examining my joints for areas of motion that are becoming walled off, and then putting
Hmm.
specific training inputs in order to re-garner those ranges of motion, right?
Yeah, I mean, it's hard when you look at everything in a vacuum because you have to also consider other stuff like saunas are great, you know. But for example, like it gets pretty hot here in Maryland in the summer, and
Mm-hmm.
I'm during the summer, I'm usually outside running like 5 days a week in like, 100-degree heat,
Mm-hmm.
and then also doing resistance training right at either at my house or like a hot gym. So am I going to get as much of a benefit out of doing the sauna during that time of the season
Mm-hmm.
versus like if I was just sedentary,
Mm-hmm.
right?
Yeah.
So you have to take everything in kind of in concert with everything else as
Yes.
well. And when you talk about like combining all these modalities, then it's also like, what do you have the bandwidth for?
Mm-hmm. Yeah.
Like foam rolling feels great for some people, but I would rather you do cars
And that's where
because you're
I'm.
going to learn about yourself. And like if you have an infinite number of time to do anything, like you're like the guy we talked about in the documentary, where you just have unlimited resources and you have the time to do it, then like everything's on the table. But you should still make sure you cover the bases that we've been talking about, which is, joint specific work in addition to doing your red light therapy and all the other stuff.
Yeah, if you have the means to change every light in your house to a red light, and every morning you wake up with that red light therapy as you're being served a perfectly nutritious meal by your cook, and then you have time to go into absolutely. But yeah, like we're making real life decisions for clients, right? We're not making general recommendations, and then it becomes, are you not doing your cars because you feel you want to use that 20 minutes to do an ice bath? Like, are you
Yeah.
choosing one over the other? And this is the problem with the internet and with this overloading amount of information. It's just that you have to cipher through that in order to determine what you can do. And that should be based on what you know will be beneficial. And what you know will be beneficial is, teach someone a cars routine, or at least don't even teach them a cars if you don't want, but at the very least, promoting increased joint specific motions throughout the day is 100% going to lead to benefits regarding the longevity of those articulations.
Yeah.
100%. Take the spine, for example. I mean, nowadays, even when I was, stabilize your spine, brace your spine, neutral spine, move around in neutral spine, pick up things in neutral spine, sit in neutral spine, don't move your spine because it's delicate. I said, well, there's a huge problem with that because you're talking about the spine and you're giving, medical advice to protect the spine. But the spine is not one thing, right? There's a variety of different motion segments in the spine, 7 in the neck, 12 in the thoracics, 5 in the, and just like the shoulder, moving the spine around in neutral spine, where your lumbar spine is the motion segments are being braced and not moving. Well, to those individual joints, those joints are immobilized over swaths of time. And
Hmm.
and that is a problem, right? So, and the only way to fix that problem, of course, is to promote motions, individual motions in the individual motion segments of the spine, which cannot happen with general recommendations of get up in the morning and kind of just wiggle yourself around. Even when people, another good example that people have now is, if you look, they'll have like spinal waves, or all of these. Awesome, awesome stuff. But let me tell you, if you've spent a lot of your time sitting at a desk and then you were told to stand up in neutral spine and play your sport in neutral spine, whatever waves you're doing, from an internal perspective, you're not getting the information to all of the joints because there's a restriction there. And I think I just brought that point up, and I think that may be the problem, is the perspective of how people see exercise always from an external perspective, where they
Mm.
need to be understanding it from an internal perspective.
100%. I mean, That makes a lot, of course, because it's like if you, I actually had this discussion with a client the other day. We were talking about getting like more segmentation, actually more multifidi activity in the lower part of their spine. And they're like, oh yeah, I do, what do they say? I do spinal extension work, like on a 45 degree and do that, like where they just go down and they work on extending their spine. Um, and I'm like, yeah, that's great, but you're only going to spinal extend with the segments that you can move, and you've got several movement blocks here. So, and that those movements are only going to get the superficial tissue. Like
Mm,
you can't like just you can't take a global movement to fix a local issue, right?
yes.
And the only way you can do that is, like you said, is get specific into that part of the spine and actually learn how to move it independently, get feedback there, and
Mhm,
eventually integrate it into something where if you do a spinal wave or if you do spinal extension, now you're loading everything.
mhm,
But if you just continue to do spinal extension, you're only going to load your right side because that's where you feel it. And then your left side's still not going to get the inputs that it is that it needs because um, you have no concept of how to actually work there.
mm, mhm,
Uh, the other thing to think about too is what we kind of talked about with global movements is that they look they obviously they look sexy, they look exciting, but they don't necessarily fix the deficit that you have in the individual movement. So I always say like, um, if you're you know how to do this because you play guitar, but if you're learning to play guitar,
mhm,
there's a segment of the population that will just memorize notes so
mhm,
they can play their favorite songs. Totally
mhm,
cool. But if you ask them to actually play songs that they don't know the notes for,
mhm,
or they haven't that's outside of the pattern that they've practiced, they can't do it. Versus somebody who actually knows how to play the guitar, they know how to play the individual notes,
mhm,
right? And the
yeah,
same with movements. Like
mhm,
if you just do like a downward dog to an open split and do a thoracic rotation, that's kind of like a global movement, right? You can
mhm,
practice that, but that doesn't necessarily mean on the individual joint basis that you're actually getting stimulatory inputs into your hip flexor, your ankle, your knee, T3 to T4. The only way you can guarantee that is to have access to it. And first of all, you have to make sure you have access to it individually before you can actually start to apply it to a global pattern.
Again, so speak to this because obviously we know it's true, but these things are trainable. Like, you know what I'm saying? Like, here's let me bring you back. I'll give you an example. You have that 45-year-old, I don't know, construction worker, whoever it is. So they come in and she has a limited amount of shoulder internal rotation, right? So she has, when you do her assessments, you find if you have a little bit of limited internal, you're probably going to find a lot of compensations. When they go to do joint movements, you're going to see movements coming from other joints to compensate for the lack of motion. You drill down deeper, you go, that she lacks this much flexion, this much abduction, this much extension. But then you find, oh, you know what? When I take the humerus and I try to rotate it right within the cat, like just stress the actual moving between the two bones that make that joint, they move together, right?
Hmm.
So what do we do? Well, she needs shoulder exercises. I said this the other day, like the fact if you give her a traditional shoulder exercise, then by definition, she's going to be doing a compensation exercise because that's how physics works, right? So that doesn't work. So it actually takes someone like you to go in and say, you have a problem, you know, with independent motion between your humerus and your glenoid. First off, in internal rotation, because we know that that's the telltale sign that a joint is degenerating when it loses rotation, especially internal for example, the hips and the shoulder. So what do you like? How do you deal with that? Because that person's going to want to exercise and that person's going to want to lose weight and that person's going to want, I want to bulk up a little bit. No one ever says, I really want this shoulder to be at least before after my assessment, and maybe you'll speak to this too. You can very easily change the goals of a client just by explaining and demonstrating what they can and can't do. But how do you deal with that? Because that is a fixable problem. You would agree for the most part.
Hmm. Hmm.
What do you do?
Um, well, I think the first thing is obviously explaining the importance of what we're doing. Like, hey, if you don't have that range of motion in your shoulder when you're 45 or whatever age, like it's only going to get worse. Like usually like people like that will come in because they have some kind of an issue. So if you can connect that to why they're in here, that's really powerful. And then let's say, for example, that their goal was to lose weight. Um, we would still try to, we would focus on the shoulder, but and also as well, concurrently, we can work on other strategies that would help them, get their goal. Let's say if they want to lose X number of pounds, talk about nutrition, as well
Mhm.
as start to introduce exercise that they can do currently that are going to promote muscle mass while we concurrently build them a shoulder. So I explain all that whole process to them, and usually they're on board. And if they're not, they just they go somewhere else.
Well, I'm
Yeah.
assuming that you've demonstrated the lack of motions with your FRA assessment with your
Right.
teaching cars, right?
Yep.
I find I find that it's almost impossible it an assessment has to be, you want at least the way we look at it, right? We want to map the person's capabilities in 3 dimensions from an external perspective, so we understand what the prerequisites are, so that you can choose exercises that they can actually accomplish safely. But you also want to map them internally in 3 dimensional space, in that you want their nervous system to become aware of what it can and cannot do. And I think that cars is a brilliant way of doing that, because again, the same example, when I go ahead and do my car and I come up, here, and my arm is straight and it's right by my ear and none of my body is moving, and then I say, you try that, and they do this, and then their elbow starts to bend, and then they have their arm out like this, and then I say, no, no, try to straighten your elbow, and then they straighten their elbow and they start to extend, and I go, you see
Hmm.
how I'm here, but in order to do the same thing, you're here. Yeah, I
Right.
feel that. And then then you correct them and then go, okay, now really try to do it the way you want to do it, the way I'm showing you. And then they go, oh, that starts to hurt. It's pinching in my shoulder. And then you go, yeah, yeah, I know. And then and then you go, well, do you think in the gym, do you do military press? Yes, I do military. And then they pause and they go, oh, if I can't get my arm over my shoulder without
Yeah.
weight, then why am I being asked to do it loaded? Right? And then and then
Right.
and then it becomes, you can almost guess. I bet you have problems in this area, other area of your body. Oh my God, you're a genius. And meanwhile, you're laughing because no, because when you ask the system to do a simple movement and then you look at where the movement occurs and you see the movement is occurring almost every time in a completely different articulation whose job it is not to be a shoulder, then you think to yourself, well, there's probably a lot of abnormal biomechanical stress being placed into that other joint that's doing the compensation, and then you can almost guess that that joint is also going to have problems, whether they know it yet or not. Usually they do because it comes out
Hmm.
of injury or pain or whatever.
Totally. And that plays into our other discussion about longevity is if you're thinking about the long game, the perspective of training, one of the things to keep in mind is that if you look at like, and you've probably seen it, all the studies on like bed rest and sedentariness, right? And especially as you get older, like if you have to, for whatever reason, you're in bed rest, like you lose so much stuff so freaking fast. Like
It's
your muscle mass, your capacities, like nature is just like ruthless as you get older. So what we can take from that is one of the things you want to keep in mind is obviously things are out of your control, but everything that you can control, you want to have as little training interruptions as you can. So
mm,
you don't want to get injured. You want to make sure that you're on the path to not having to train interruptions because it's different if you don't train for 2 weeks when you're 40 versus if you are incapacitated for 2 weeks when you're 60 or
yes.
or older. So in your decisions, you want to make sure that you have the best joints that you can personally have within your circumstances, and also make sure that you're taking training decisions that are going to lead to continual training. And it
Mm,
sounds obvious, but like it obviously it can get more complex than that. So picking activities that are the best suit you, right? For me, like I don't really have the mobility to be doing tumbling, so I shouldn't be doing handsprings. I shouldn't take up handsprings or Olympic lifting at the nice tender age of 38. This doesn't make sense, right? I just do things that agree with me. So if you have like really shitty knees, I don't think taking up basketball at 45 is probably going to be the best thing. Doesn't mean you can't shoot, but you're just going to set yourself up to have train interruptions, or injury injury down the road. And the other thing is like you said, if you have a joint that's been bothering you, if you have areas like you're not going to grow out of that, right?
Mm. Yeah, it's not
You know,
gonna,
like, oh, my body will figure it out when I'm 48.
yeah,
My
yeah, yeah.
shoulder pain will go away,
Yeah.
right?
It's not gonna get better.
Uh, yeah, exactly. Yeah, no, you want to always consider like the things that you're doing that are going to keep you healthy with quotes, because that's always a different definition, but are going to keep you training and moving in the long run. Because that's the thing, you don't want to avoid, you don't want to have injury. You don't want to like, oh, fuck, I need shoulder surgery,
Yeah.
and I'm 55 and I'm not gonna be able to do anything with this arm for like 6 weeks.
Well,
The
now
big, yeah,
now that the problems of immobility have just spread to the entire body versus just the individual joint that you're having the problem with, like you said.
right.
Yeah.
Yeah.
Like
So that's a big part is avoiding training interruptions.
I think there's also something to be said. You mentioned mobility is the promotion of mobility allows you so that when you are undergoing training interruptions, you aren't necessarily immobilizing the body because you can utilize your body to purposefully compensate for the lack of motion you have, if that makes sense. Like if you give me someone who has trained well in mobility and they have good um, active control over their hip ranges of motion, right? For example, they can, yeah, and they also train their toes, so they can grab things with their feet and they can bring things to their hands with their feet, which is something that I do. And I've always encouraged my children since they were born. When we're picking something up, if I see them bending down to get it, I'll be like, no, no, try with your feet, try with your feet. And the fact that I can grab something or you can grab something with your toes that you dropped and bring it to yourself, it also it helps immensely in the rehabilitation of injuries because if
Mm,
I have a back problem, if whatever happened, acute spasm or whatever, something happens and I have a back pain, I can still get around. Like I can purposefully lock my lumbar spine and then utilize my hip joint in order to pick things up off the floor. I can avoid areas that are healing and I can continue to train better than someone who is walled in. Like the more you're walled into yourself, the less options you have. And options are the that's the difference between rehabbing for the next 3 years versus the rehab taking 6 months, is that the more options you have to unload that tissue but maintain movement, the better off you're going to be. So it's also
100%.
it also behooves us to think about mobility training or range of motion cultivation for those purposes as well.
Yeah. Yeah. I mean, it's basically you have like a detour. You can take a detour. If you can't bend over, you can use your feet to pick up that object. Right.
That's right. Yeah, that's right.
Um, what else are we talking about?
I, yeah, I mean, I think that pretty much sums it up to the extent that we want to promote individual joint motion, and then we also want to promote the training of lack of motion or of lack of function in individual articulations. But I think another direction to go here is to discuss the idea that this is not the only thing you get to do. Like, for example, I've watched you train your clients, and I see, a lot of different exercises, a lot of different strength exercises and power exercises and speed exercises. And somebody who has heard of the system or doesn't understand the way that we manage people, they might think that you're always locked into, I got to increase internal rotation, I got to increase wrist dart, so I'm going to completely omit all of the other training and I'm never going to deadlift again and I'm never going to do all of the fun things I like to do again. And I think
Hmm.
it's worth pointing out that that is 100% not what we're saying, right? these
Hmm.
these things happen in good programming of a person. You can be training for performance and longevity simultaneously. Does that make sense?
Yeah.
But it has to be purposeful. I was just talking to Hunter the other day, and he was talking about his management of Sydney McLaughlin, the
Mm.
full throttle hurdler. What was I going to say here? and he was saying, what was I just talking about? I just had
Performance and longevity.
yeah, and we were discussing the idea that if you train individual articulations for if you train individual articulations for where were we again? Say it again. I just got
You're
dinged.
talking about performance and longevity and training.
Yes,
Um,
yeah, sorry, I'm sorry. Longevity training. So let's call longevity training joint specific, tissue specific training, making corrections. That will lead to better performance, right?
right,
You have better joints, better functioning joints, cleaner afferents, better signals coming from the joints. Your central nervous system gets to make better decisions on a movement basis to deal with incoming variables. If you give me healthy joints, I will give you a direct path to better performance. However, it doesn't go the opposite direction. Better performance will not lead you to healthier joints. In the other direction, it's actually a detrimental arrow in that the more you excel at a preconceived notion of what performance measures should be, the more that joint will change in order to give you those performance measures, even if it's taking away the longevity and health of the articulation. So longevity training leads to performance, but performance training does not lead to longevity, right? So
right.
you have to combine the two, and you have to do this because we've dealt with retired athletes. And for those of people who have not dealt with retired athletes, find a retired athlete, right? And look at how they move and look at how their body functions in three-dimensional space. You remember that time we were at that hotel?
I was just thinking, I told that story the other day to
Yeah,
somebody, and they were
and it was
laughing.
the oh my God, it was the NFL.
We were
Oh
with Quinn. It was in Arizona. We happened to be at like
yeah,
the NFL like owners and coaches meeting, like the annual meeting. We happened to be staying at the same resort
yes, and
by
let's not
luck.
let's not say the athlete's name. Okay. This just so what happens is we get up in the morning and we start walking to the front to get our Uber because we're gonna go teach. And we see this guy come out of his room and he was limping, right? It's like he could barely move. He could like he looked like he was in pain. He did his movements were not dynamic. It was we were just
Yeah,
discussing. And then the guy turns around and we're like, oh my God, that is this athlete who is a NFL Hall of Famer, right? And we're like, oh my, we were
not and he's not that old. He must have been in his 50s at that point.
absolutely. And then of
Right.
course we go to the seminar and then I start telling this story, but I'm omitting the name of the person we're discussing. But you decide in the back of the room to help me, and you Joe Smith. It wasn't Joe Smith. I don't want to say the guy's name. And it just so happens that we were just talking about how clearly, in his training, the people who were training them were not considering longevity. And then, of
Yeah.
course, it comes up that the entire staff of that person's team is in the front row of the
Oh,
seminar.
were they there? I forgot about that part.
I'm pretty much saying, of course, this is 50 years ago, however many years ago. It wasn't these guys, but we were pretty much insulting their system of training, saying that you didn't help this person. But anyway, it's a good point, man. It's that people who were used to be high performers are not the pinnacle of musculoskeletal health, um, unless there's genetic factors. Again, I'm always going to bring in genetic factors. I don't want to make it sound like we cannot we can alter the way genetics are expressed, but we cannot alter the genetics themselves, if that makes sense, right? So just doing even like
Yes,
if you have a knee joint that's predisposed to osteoarthritis and a family history of osteoarthritis, I'm not saying that you can, thwart off the cellular processes that will lead to osteoarthritis, but you can do the best you can to maintain the joint spaces you have if you actually put the effort in to maintaining the joint spaces that you have, which means
sure.
specific training inputs coupled with, injection of more joint specific motions throughout the day.
Yeah. So I think in summary, like build muscle mass,
Mhm.
maintain cardiovascular health, and maintain articular health. And
Mhm.
that's the best you can have for longevity. And usually people only focus on one or two of those things. If you
Mhm.
focus on all of those, because like you said, we talk about entropy, like you're going to lose a certain amount
Mhm.
of all of your capacities as you age. You just have to.
Yes.
You're going to lose. I think I've seen it's like Is it 9 or 10% of your VO2 max you lose every 10 years? Can't remember the exact number, but it's something significant.
That's significant, right?
Oh yeah, that's
That
huge. I
much,
mean,
eh?
yeah,
Obviously, an untrained people.
yeah.
Wow, that's a lot.
And there's a certain number you need to like be, a functioning 80-year-old,
Mm, hmm
so you at least want to have that number.
hmm
So if you know that, like you just have to maintain that. And again, that's avoiding training interruptions as best as you can by making good choices, right? Obviously doing all the other stuff that's already out there that's good. Nutrition, sleep, managing stress. But I think what's underplayed, like you said, is like it's very easy to go for these sexy modalities. Like if I ask you to just do like, do you want to sit in the sauna where you could just chill, or do you want to do like a really hard like kin stretch class where you have to go against yourself to find your end ranges and it requires a lot of energy? The average person is going to go sit in a sauna,
hmm
right? So if you're talking about time and what's best bang for buck for time, um, strength training, joint specific strength training,
Yeah,
cardiovascular work, and then
yeah.
you can sprinkle on all these other modalities as well.
Because
But as long as
those ones have to be there. Like they have to be there,
yeah,
and they should be programmed, right? They
yeah,
should be specifically programmed for because like you're alluding to the concept that from a musculoskeletal standpoint, there is no such thing as homeostasis, right? It's either you're building or you're breaking down. And the only way to quell the speed of entropy is through physical training, right? Physical training allows you to quell how quickly that entropy is going to proceed. It doesn't stop the entropy, right? But like you're saying, if you're not building muscle mass, there's going to be a point with your father doing the same exercises where whatever those exercises are able to maintain, the rate of entropy is going to exceed those inputs' ability to maintain, and then you're going to get deterioration, which is why you constantly want to do this push for more, right? Easier
mhm,
example is I've maintained my weight. I've always done 20 minutes on the elliptical every single morning, da 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 da, da. And then you start to age, and then you're like, well, now I've put on 5, I've put on 10, I've put on 15. Well, it probably because you've accommodated to your stimulus, right? The body accommodates to the stimulus by providing you the output you want, but reducing the amount of energy expenditure that you need in order to accomplish that. So if you're doing 20 minutes a day on the elliptical, you know, for 10 years, 9.5 years ago, or even further, the body already accommodated to that amount of exercise, and it's found out ways to decrease the amount of energy expenditure or energy that you're for that exercise, in which case entropy will take over, and you'll be going down instead of maintaining.
yeah, for
Yeah.
sure. Yeah, yeah. It's like it just kind of goes to our point when we redefined like GPP back
hmm
in when we started doing Kinstretch level two. And the idea that general physical preparedness was usually a way of maintaining qualities that we saw in athletes, right? Like speed, agility, strength, power, right? But when we break it down to a joint specific level, all of those qualities are only outcomes of how the system performs as a whole. So therefore, we have to work on the individual parts of the system, and that's really the GPP. So that's what Kinstretch is. So if you think
hmm
about longevity, if your goal is just to age gracefully to do the activities that you want to be able to do, then longevity training really is GPP
hmm
outside of any specific endeavor. Like unless you're like an 80-year-old marathoner, it's really maintaining the qualities of the individual joint system, or the individual parts of the system.
hmm Yeah, that's you put that brilliantly. It's yeah, I don't think I could have mentioned that any further. So when you have for your clients, do you prescribe a lot of homework in order to take care of some of these necessities? Like for example, joint specific motions throughout the day. So what is I'm training with Josh, and what are you having me do specifically for longevity? In the training sessions, you're going to fix that internal shoulder rotation while also getting them back to benching and strength training. But what else do you do for them? What else do you recommend for
Yeah, I
long?
mean, uh, obviously, like cars every day. So you're trying to instill a habit of movement every
Mhm.
day, and it depends on the person. Like, I have a lot of my people now are mostly athletic people, like other trainers or people that like to move. So you don't necessarily have to get them to move. You just have to program like what to do when they want to move,
Mhm.
right? Because you want them. I always say that it's so important that you learn what to do when we're not together, right? Because
Mhm.
if we're only together like 2 hours a week or 1 hour a week, right? There's other stuff. So a lot of the sessions in the beginning are teaching them what to do when I'm not around. So that's cars, or if that's joint specific homework, like working on hip external rotation. Here's what I want you to do, sets and reps. And then eventually, as they get to a point, usually they're in my kin stretch classes, like my online stuff, because that's just a great way to supplement the other stuff that we're doing. Or if there's somebody who's like, they see me once a week, they go to the gym on their own, they do like 3 days a week of that, right? So our in time session is working on the rest of their program or working on specific stuff that they're not addressing in the gym. And then
Mhm.
also they're usually doing some kind of like kin stretch or body practice just to maintain the stuff that they're not getting in the gym. So I always say like kin stretch is like the way we think of like kin stretch is it's basically the multivitamin for the inputs that you're not getting from your sport or
Mhm.
your activities, right? So for me personally, like, I like to run, which is ironic because I'm not good at running, but it's kind of why I like to do it.
Mhm.
But there's a lot of stuff that you get from running, but there's even more stuff that you don't get. So my activity, my train outside of running is going to be the stuff that I don't get, right?
Mhm.
Rotation, strength training, maximal efforts, you know, whatever it is, shoulder flexion, different things like that. So the stuff that I'm doing with my people is going to be either to maintain so that building that GPP as well as homework for their specific issues. Like you don't have
Mhm.
an ankle that can dorsiflex, or your right knee doesn't have tibia rotation. Well, we're going to focus on that, and we'll address it in our sessions if we need to. But you know what to do on your own. Let's move down the line and work on the next big thing, or let's focus on split squats if we're teaching you that movement. So it really
Mhm.
depends on the person, but generally it's our sessions are hyper focused on what they can do when I'm not with them, and then they're usually in some kind of like GPP can stretch phase on the other days.
And how about let's talk about now, because it's easy to take this concept of longevity and think of the 50-year-old man who's not moving well and what to do with elderly populations. But I don't want to underplay the importance of this type of training for high level performance athletes, right? Because it, I'm just trying to pretend that I'm someone on the internet who's never heard of us, doesn't know who we are, listening to us, drone on about these. You have to do these joint specific motions, and it's so easy to say, yeah, whatever, but I'm trying to get stronger. This is nonsense. We need to lift more. Like that kind of mentality. And then
Hmm.
and then I guide them towards someone like Strange Grayson,
Yeah.
who just did that. Did you see that last thing he did? That bent press with like an 80-pound kettlebell or something crazy. Did you see that?
No. No.
Ridiculous. Like I've never seen a kettlebell that big, and he just did a bent press with it. And
Like a cannonball, like just a giant like carnival
yes.
cannonball.
And again, that's one of the strongest guys that you're ever going to meet. And ever since he took the ISM, the internal strength model, and he'll tell you that, like you can message, he'll tell you that things that he hasn't touched before in a long time, like that particular lift, he doesn't even have to touch them because he's pushing the capacities of his joints and tissues to higher and higher levels of capacity, and then he's kind of emerging this demonstration of strength, but he's getting the benefits of joint specific training for longevity, right? But he's also putting up increasing PRs on a weekly basis on a variety of different strongman lifts, which goes to speak to the point that this type of training is not going to, if you want to get super, super strong, right? We've been in the sports world for a long time. Everyone knows this. There are people that come to us who need to get super, super strong, and we'll get them there. But I will also make sure that shoulder internal rotation is dealt with maybe in the first 4 to 6 week wave that we're working with them, right?
Hmm.
Then people go, well, I want to get to it now. I think the confusion there is that we're not saying that you are, just moving your shoulder around and just doing, little red band mobility exercises. We take the intensity that you use for a bench press and we funnel that intensity into the training of the shoulder such that when people actually train with you or with like they almost beg you to go back to deadlifting because when you're doing a max effort, let's say input 3 for the connective tissue of your shoulder moving to length. That is not a type of rehab exercise that people promote. We're just taking the exact same intensity, the exact same focus, and we're funneling it into a smaller target. But you're not losing intensity on the back end because intensity is really the driver of adaptation. And that's another problem that I think people have when people get injured and they go to rehab. All of a sudden, the idea that intensity matters is completely off the table because you take an enormous power lifter who has some shoulder pain and you go and you give him a red TheraBand and you say, do 3 sets of 10 on external rotation because it's a therapeutic exercise. But that's not therapeutic for him. That person's body is not going to, you know, unless there's a tissue, but you understand what I'm saying, right?
Hmm.
Like just because you're rehabbing, it doesn't mean that the intensity only has to come as low as it needs such if this is your tissue and then you damage the tissue so now the amount of force it can absorb is here, you need to bring your force inputs below that so as not to injure it, but you have to be right there, like you're still pushing the envelope. I always say when I'm dealing with a tissue injury, a torn hamstring or something like that, I'm doing max effort training for the hamstring. People go, that doesn't make any sense. When what you're not understanding is your max effort training for a damaged tissue ends up being somewhere right about there. This is where people
Right.
start do their rehabilitation, right? They do it here. And if you rehab here, yeah, you'll make small gains in the tissue. But if you rehab here, you can make much better gains in that tissue by ensuring that you're actually challenging the system at the level it needs to be challenged. If you give, if you give a power lifter, a body weight squat for the same number of reps that they're doing for their max effort, that's not going to change. The system is not going to change because that's not even a signal for that system, right? You have to, that's why max effort training is there to push the capacity of that nervous system higher so that you can squeeze more out of that tissue. Same with rehabilitation. It's just at a
Mm.
different scale. You want to be at the scale that you're not causing injury by exceeding load bearing capacity, but you also don't want to be so far away from the new load bearing capacity that the tissue just doesn't get stimulated enough to cause adaptation. You need to push that envelope at a different scale. So I think what I'm trying to get at is this is not we're not taking away exercises. We're not doing Olympic lifts if that's what you need to do. We're just prioritizing where you're spending your energy dollars because you do not have an infinite amount of energy, you do not have an infinite amount of time, and you do not have an infinite amount of adaptive capacity in your tissues. So you have to make decisions, just like, am I going to sit in this ice bath or am I going to do more cars, right?
Yeah.
These are the questions that you have to really consider.
Have you noticed, I'm sure, that stronger people progress faster,
Yes, 100%.
way faster, right?
100%. 100%. And that's such a good point. And why? Because they can harness the nervous system's capacity and focus it into whatever it is they do because they're strong, because they
Yeah.
know. Yeah. Is that what you were referring
Yeah.
to?
Yeah, exactly. 100%. Yeah. No, totally. Right. Yeah. It's I have one of football players I used to train, he's retired now, but a lot of times he would come um in the off season and we would check like a lot big issue for him was obviously shoulders and hips, a lot of stuff. But
Mhm.
let's take a shoulder, for example. He would have like, 5 degrees of internal shoulder rotation. It's pretty jacked up. Um, but he also was like somebody that could bench press like 500 plus pounds, maybe 600 pounds, like strong person, right? Like 300, over 330 pounds. because he was so strong, like his shoulder internal rotation, he would get to like, I don't know, 45, 60 degrees in like a couple weeks,
Mm,
just because 3, 4 weeks, because he had so much force that he
mhm,
could put in there,
mhm,
right? And it's just such a light bulb moment because if you took that same person and you just same exact issues and you like halved their strength, so maybe now he can only bench press 300 or he could deadlift, half of what he could deadlift. Like he would everything else being equal, it would probably take twice as long,
mhm, mhm,
because it would take way longer. So strength training is a huge part of that because sometimes you have people who are really stiff, right? They just don't have a lot of range of motion. They also are really weak. So when you
mm,
teach them to do like isometrics, like tails and rails, they don't really have a big engine that they can start up that's going to actually put force into the joint. So you
mhm,
actually need to strength train with them as well, like like traditional strength train, or try to get them to learn how to irradiate using
mhm,
something like deadlifts or squats or isometric holds, in addition to their tissue specific work, because essentially their nervous system does not have enough compression to get the most out of those inputs. So bottom line is that the stronger somebody is, the faster they're going to progress in something like joint specific work. So it's just as important as well to make sure that they have the ability to control their nervous system and funnel that energy to get the most out of it.
That's brilliant to bring up. I think to sum up what you're saying is that neural output is a trainable quality, right?
Mm,
Independent of anatomic biological adaptation, the ability to drive and compress the nervous system for when you need it is a trainable quality that should be um, garnered in anybody that you're training, which is why, again, we go back to max effort training. And we've talked about this on a bunch of podcasts now, but all of our athletes in season are still doing max effort training. People would argue, and as a lot of sports organizations have originally argued to us, well, we don't want to cause injury. And then we have to explain to them that, oh no, I'm not telling you to do Olympic lifting in season. I'm telling you to pick an exercise that the person likes to do and that they're very good at, which and that is biomechanically, let's say, not dangerous
it's
and
appropriate for them, right? Yeah.
appropriate for them, and just use that to drive neural training, and don't even worry. I don't even care what, like we always say, I don't even care what the person chooses, right? There's a whole thing about deadlifting with a bar versus a trap bar. Who cares when you're dealing with, unless your job is to deadlift for competition. If you're dealing with I don't know, a tennis player, I mean, it doesn't matter if you're deadlifting with a bar or with a trap bar. All that matters is the effort and the output of intensity. You're really training your intensity meter independent of your biology. So if you
Hmm.
have a high intensity meter where you can irradiate and output a lot of neural drive, then you can funnel that neural drive back into your tissue specific training. And like you're saying, the gains in your tissue specific training are that much faster because the controlling factor, which is the nervous system, you've trained the ability to access and harness its potential and its output.
Yeah. I always explain to my clients, like, let's say we have two Dre's, they're the exact same person, right? They both have, very limited hip internal rotation. The only difference between them is like Dre one can deadlift 200 pounds and
Mm-hmm.
Dre two can deadlift 350 pounds. Dre two is gonna build a hip considerably faster than Dre one because he has that clearly that not because of the deadlift, right? But it's because through the deadlift in this case is just a proxy for neurological output, right? And the Dre 2's neurology is able to funnel that energy, funnel more neurological output into something like hip tails rails. So that
Mm-hmm.
means that when he asks his nervous system to squeeze and compress, the muscles are gonna torque, which are gonna torque the bone harder than the weaker Dre, which is going to cause more biological adaptation to happen.
Mm-hmm.
So, like you said, there's people that are just, you need to increase their neurological drive, what we call strength, right? Because strength is a behavior, not a thing, so that they can actually make the gains that you want to make in joint specific training.
You're 100% right. And also, to the outside world, might be 100% confusing because, yes, strength is what prevents injury, for example, right? But there's a misconception as to what strength is too, right? And like you said, it's a behavior. So just because you're strong, it doesn't necessarily mean you're injury proofing yourself, because with regards to injury proofing yourself, the benefit of strength has to be specific to the tissue that is undergoing the load that ultimately leads to your injury, if that makes sense. So in other
Hmm.
words, yes, if you can compress your nervous system, you are going to progress faster in almost anything with regards to training. But just being a generally stronger person does not mean you're going to, and I mean strong in the general sense of how people consider what strength is. You are not more injury proofed than other people, right? It's not general strength that prevents injury. It's the ability to discharge strength in the particular tissue that's absorbing the force, which would ultimately cause that injury. So tissue specific strength prevents injury. General strength um, might help prevent injury, but it's not going to prevent injury the way Instagram is telling you that you can't go wrong with strong and strength. You see, that's the weird thing, right? You take this concept, strength prevents injury, and then you completely um, misunderstand the specifics of that mantra. That
Mm,
thinking that power lifters never walk into my clinic with injuries, and let me tell you, that is 100% not the case. I treat a lot of power lifters. You know what I mean? These are the
yeah.
strongest people you'll ever meet, and they have injuries. So that just goes to the definition of strength and people's understanding of what strength is.
You have to like peel that away too. You have to unpack it because a lot of times like strong can be like strength, whatever, is a proxy for like, okay, increased muscle mass, right? The more muscle mass you have, the better you can absorb force. And like, let's say for something like a combat sport in like football, right?
Mhm.
Somebody who's same person, if they have, if they're 15 pounds heavier, right, and they get hit, they have that 15 pounds more worth of stuff, more stuff to absorb with,
Mm.
right? So people can conflate like, well, we have to squat and bench press and put muscle on because stronger is going to make them less injury resistant, or it's going to make them more injury resistant. But you have to break that down because they're conflating having more stuff to absorb things with an exercise.
Mm.
When it's like you said, it's very tissue specific. So just
Mhm.
because you're an animal in the big three like squat, bench, and deadlift doesn't necessarily it doesn't mean that you're more resistant to not spraining your ankle when you go on a hike,
Yes, yes, I
right?
see. Yeah.
But sure, you're going to have more muscle mass. So if you fall, you're going to absorb that probably better than somebody who's, who's like your counterpart that doesn't do any training. But it's
Mhm.
easy to conflate that. And that's why I think one of the things that we really focus on when we teach the courses is just being really specific, not just with our training, but with our language. So that we're
Mhm.
actually aiming for the right thing. So if you want injury prevention, like you were saying, it's really tissue specific strength for an injury that you're specifically trying to avoid.
Mhm. Yep,
Right?
100%. Brings
Yeah.
up another question this sounds complicated because we are, you know, deep into the weeds, and we have to be because we're filtering this information backwards to our clients, to the people that we teach. Um, I know how I feel about this, but when in practice, do you ever run up where the person's like, "This is all too confusing. I can't. I just too much for me. I'm not going to do it." Because I've never had that experience.
No.
The reason I say that is online, like people might think that what we're saying is completely inaccessible to the layperson, which is couldn't be further from the truth. Because what have we been talking about for the last few hours is just try to specifically move with your joints, like put more joint specific.
Mhm.
You can't make that more easy, right? But do you ever have that scenario where people are just lost in the training?
Like lost as far as like don't feel like they can do it, or lost as like from the outside looking in,
Like
thinking that like it's not worth
they
it.
don't understand what's going on, or that it's not worth it, or that
Yeah. No, I actually don't really run into a lot of that. I mean, uh I think it all depends on how the conversation's for. Like clearly you and I are just kind of just talking to each other because what we're we know what each other thinks on most issues. And probably the most vast majority of people that listen to this are going to be in the community that we try to cultivate. But just like me, like myself, you will change the conversation if you're talking to a completely layperson and make it
Mm,
really, really easy for them to absorb. So it depends on who the person is.
mm,
If I'm talking to like the mother of a high school athlete, like for sure, I'm not going to be doing the course in front of them, right? I'm going to
mhm.
keep it very simple, but that's where you have the power of analogies that you can bridge the gap of understanding. So I think if people are getting resistance now, this is not accounting for the random troll that leaves a comment on a video or something like that. But for the people that are generally or in good faith don't understand or asking questions, it really depends on how you talk to the person, right? Because yeah, in this conversation we can get pretty in the weeds and kind of vague, but also specific about certain things. Um, but yeah, I don't really run into a lot of that.
I want to wrap up with something maybe that we should get out, just so that people listening, like you say, that maybe fell into this podcast and are not really in the weeds like we are. There's some generic things that I think we can give advice for, that might actually help people in general, like just generically. One that I'm going to put out there is you don't have to back squat. Like you don't have to do that. I have a lot of orthopedic surgeon colleagues of mine, and we discuss this regularly, that deadlifting max efforts, and please understand that I and you have to deal with the entire spectrum of types of people, right? People who have diseased, or people who have pre-existing conditions, people who are generally sedentary, uh, amateur athletes, professional athletes, retired athletes. Like we're dealing with a spectrum of people. So when I say that you don't have to deadlift, the person who's listening to this, which is who I just want to get stronger. See, this person's not going to get me stronger. You have to understand that we're giving generic advice here. Unless you have to max effort deadlift, there's probably other things you can do that have less spinal penalty, that have less
Mhm.
risk of spinal penalty, which will get you the same benefits that you think you're getting from deadlifting without all of the damage. A good example is good mornings versus a reverse hyper, right? Like the whole story of how a reverse hyper was created was because Louis Simmons had, I forgot what he did, fractured his spine. It was a very bad, and it was from doing good mornings. And I believe, if I hope I'm saying this correctly, but maybe we can ask John Quint to corroborate that, because he treated Louis when he was alive. But that's kind of how he developed the reverse hyper, understanding that a good morning is a very good exercise, but pushing the boundary of a good morning isn't always a good idea. Some people it might be. I'm not saying not to do it. I'm not saying it's a bad exercise. I don't think there's any such thing as bad exercises. I think there's just people who are not prepared for those exercises. But when you're making selections and you don't know what you're doing, and you're on Instagram and you're watching these people say that you have to be functional and you have to, deadlifting is it's the king of exercises and you have to do it. And people are out there and they're squatting with a bar on their back, which is, it's not really a good, even if you're doing it well, you are compressing the hell out of your spine, right? And if something very small goes wrong, we're talking about herniating a disc, which will change your life forever.
Mm,
And I think that the current advice on social media might be pushing people towards thinking that these things are necessary for everyone, and that the risk is worth the reward. And I'm telling you, it's not. And you can take it or leave it, but I've been training and dealing with musculoskeletal injuries now for over 20 years. And I can tell you that the people that I've dealt with who squatted themselves into disc herniations, if they can go back and talk to their former self, they would have decided that maybe I could have done well with a one-legged squat holding weight, right? As opposed to, you know,
Right.
same with Olympic lifting. It is not necessary to build power. It is not necessary to emulate what powerful athletes do in their sport, like Olympic lifting, right? Olympic
Right.
lifting is a sport as much as it is an exercise. Um, and I would argue that unless you are involved in that sport, I would be very cautious of selecting, you know, Olympic lifting and pushing that boundary if you're a 38-year-old father of two whose actual goal is to be able to play with his grandkids when he's 60 or 65. Because what you're doing now, young people won't know this. And no matter how many times I say this, and I've said it over years, if you're young, right? If you're like 25 years old in that kind of I know everything kind of age category, you're not going to take this to heart. And I feel so really bad for you. I almost wish I could inject osteoarthritis of the knee into you temporarily and let you have it for like a week to I swear that would fix the problem.
Yeah.
You just don't know how bad it is that when you get up and it's raining outside and the entire day is shot. I'm thinking of my patients because your joints are
Yeah.
so swollen that getting out of bed is detrimental. And then you think back to that, I squatted 315. Good stuff. Like now you can't
Yeah.
toes, right?
Totally. Well, I mean, it's funny now. It's like, as you get older, you just get more sensitive to where life takes you and how it turns and everything that can happen by chance and also kind of affects the advice you give. So for me, my thing is always like just do exercise you enjoy doing that's orthopedically appropriate for you, right?
Mm.
That's like the number one thing is so ideally there's some resistance training in there,
Mhm.
right? Because of all the benefits from resistance training and obviously taking care of your joints and practicing full range of motion. I mean,
Mhm.
you can figure it out on your own, right? Or you just join a Kinstretch class.
Yep.
Like that's really like you can
Yep.
go find it, piece together and stuff like that if you're not, especially if you're not going to get into being certified or anything like that, or just go find a Kinstretch class and do that because that'll take care of it. Right. So if you kind of get that GPP and then whatever the activity you like to do, you like to resistance train, strength train, and it doesn't hurt, right? You're doing stuff that you know that is all right. Great. If it's something like you like to play basketball and you don't have any issues, it's just something you like to do twice a week with your buddy. Because ultimately, if you like doing that activity, you're going to stick around with it for long enough,
That's right.
right?
Yep.
Does that, I mean, do I think like, doing Zumba for like 5 days a week is the best use of your time? No, and probably not the most sustainable.
Mhm.
Again, you're talking about wear and tear. I'm not necessarily advocating for that, but if that's the only thing that you're going to do to express movement, and that's what, fills your cup, do Zumba, do some kin stretch. You
Yep.
got more capacity, do some resistance training.
Yep. If you don't
So
want to do at least learn a cars routine. Like
yeah,
it's not like it's like right now cars is you probably go online and you'll find people talking about cars that have no idea that I exist, you know what I mean? Like the system exists. It's like
yeah,
it's in the ether now. It's
yeah,
not
yeah,
hard. It's not hard to find a routine. And even if you do it, even if shitty cars are better than no cars, right? Like just
yeah,
or I can just sum that up as experience the ranges of motion you have on a regular basis because it will bring health to your articulations, imbibing new fluids, getting rid of inflammatory, getting rid of metabolic byproducts. It will increase blood flow to the area. It will increase nutrient exchange between, for example, the cartilage, which has very poor blood supply, and
hmm
nutrient absorbing abilities is completely dependent on the mechanical movement of those joints. Just do that, man. If at the very least learn what your joints do and then do what they can do on a regular basis and work on areas that feel restricted as best you can while doing what you love. I think that's
yeah,
the most generic musculoskeletal longevity advice that we can pull from the past however many hours we've been going at it.
I couldn't have said it better, man. That was it.
That was it. That's it. That's